Regulatory compliance and constantly changing guidance documents is really a challenge for any pharmacy. But when we look at what are regulations and guidance documents about, it really boils down to one thing, and that's process control. If we can meet process control requirements, we can easily satisfy guidelines and other types of regulatory documents. Where it becomes problematic in regulatory compliance is the human factor. Humans are notorious for resistance to following standard operating procedures, but more than that, even outside of intentional digression from a standard process, is the human intrinsic flaw. Decades of studies in high reliability industries like aeronautics has demonstrated that even the best professionals have an error rate of about 2 errors in every 1,000 actions attempted. Now, while that doesn't sound really high, we have to understand that's per 1,000 actions. If we think about making a typical IV medication, it usually takes about 20 different actions to do that. So if we make 50 preparations, we're already at 1,000 actions. And using the data from all these studies, that means 2 of those 50, or 4%, actually have a flaw of some type in them. Now, that doesn't mean it's going to be harmful. It may be a simple error. However, it could be a catastrophic error, like the wrong drug was admixed into the bag. So it's very important that standardized processes are followed all the time. And when we look at automation systems, whether it's technology-assisted workflow or whether it's true full automated compounding system, our goal with regulatory compliance is standardized processes. And really, how much easier can it get from a standardized process perspective than pick up your consumables as directed by an automated system, load them into a machine, and then press a start button and walk away. And when the machine is done making the doses, it outputs them automatically in a fully labeled fashion. And that's what RIVA does. RIVA is designed from the ground up to ensure safety, which leads directly into regulatory compliance. Our goals from a regulatory perspective are to ensure safety of the public. So by ensuring that the accuracy of the dose is present, which RIVA does through multiple gravimetric checks, barcode checks, and then visual recognition systems to ensure that every dose is made properly, and then does that in high velocity HEPA filtered air, that meets our second big regulatory requirement, which is sterility. If we look at what has RIVA done worldwide, we've done over 300,000 sterility tests successfully in RIVA. A lot of these were done in GMP systems. So we've shown that the sterility reliability with RIVA is extraordinarily high. From a standard operating procedure perspective, we have a team of professionals that works with each facility in bringing in automation. You can't just drop an automation system in and expect it to replicate current processes. So by working with our team, what we do is look at the entirety of the sterile compounding process and ensure that bringing in the automation helps make the entire process better, not just those medications that RIVA is preparing. Finally, one of the biggest challenges with regulatory compliance is documentation. As standards are evolving and rules, regulations, and laws require a higher level of documentation, having an automation system that automatically records every compounding event that occurs, automatic recording of lot and expiration dating, these things play in very strongly into establishing the pedigree of a product. Second, with the GMP version of RIVA, the environmental monitoring is all automated. There are thousands of data points flowing in continuously that allow us to both track and trend to ensure and prove that our compounding environment is remaining safe at all times.
For more information, visit arxium.com.